Hi guys, welcome back to my YouTube channel. I'm Dr. Fatma Salim. Today I will be presenting together with my colleague Mr. Mbogori, who is a radiographer on X-ray images, X-ray machines. He will take us through on what happens when someone comes to do an X-ray or to request for an X-ray image and all that. Well, X-ray usually produces images of tissue, organs, and bones. With bones, it includes teeth as well. And for tissues, for instance, when someone comes for a chest X-ray, so the X-ray will show us will show us images of the lungs, if there are any cavities or not, or if there is anything abnormal that can be noted and all that. So that's the function of the X-ray. Well, X-ray has less amount of radiation compared to other imaging machines. For instance, the CT scan. So most of the time you'll find that patients are caught in between. They don't understand why they are asked to go and do a CT scan or to go and do a chest X-ray and all that. When it comes to prices, patients, most of them definitely prefer to do a to do an X-ray because the price is quite lower compared to a CT scan. CT scans are expensive, except that they're more detailed. They're more detailed compared to X-ray images. With CT scan images, one can be able to get a clear picture of a disease or a diagnosis, a prognosis, and all that. One is able to capture a lot compared to an X-ray image. Nevertheless, X-rays are cheaper, and the amount of radiation compared to a CT scan is way lower, because one CT scan image could range between 100 to 800 X-rays. So the amount of X-rays for one CT scan, in order to to reach the level of radiation one would be exposed to, it will take at least 100 to 800 X-rays to get that equivalence of radiation which one would get when they are exposed to a CT scan. But a CT scan becomes very eminent in some cases when one needs to know the prognosis or the depth of a disease. Well, that being said, let's see what our colleague Mr. Mbogori has to show us on X-rays. With regards to X-rays, please do not forget to subscribe and kindly give this video a thumbs up. I hope you will now get to understand what the X-ray images entails and all that.
I'm a radiographer. I work in X-ray machines. This one is a general X-ray unit, and this is general X-ray unit, but you have to turn it to a DR system. With this plate, you can take all the examinations you need, and then this plate will be sending directly to the computer, so that from positioning here, from doing the exposure, then you can go inside here. You find that everything has come to this unit here. Yeah? And you take the exposures, you take your picture like this one we did for a small kid for the knees with the same machine, and then immediately you take it there. You don't have to carry the cassette, or you don't have to. The picture comes directly to the computer, and then you can do your manipulations there. That is the contrast. I am putting the tags like the left, the right, or any information you want to write, you can put it on with the computer there. And the exposures are done. Once you position the patient here, let's say you are taking a hand, you have to use this one, then position the hand on this plate, then you come and Sorry. This is a control room. This one, you have to settle your KVs, MAS, time. So if it's for their hand, like this one was for the hand, then you put, you set your KV, I mean your parameters there. After setting your parameters, then you just prepare and then you shoot. And then that operator will take the picture to the X-ray to the computer, and then you are done with that.
So this one looks like a small room. Why should somebody be in this small room?
Which?
This one.
This one?
Yeah.
This one is good. You come here, look at this. This one is not only in a room. This is for protection because of radiation. Okay. You can see it has got this metal, red. This is red metal. Yeah. This is wood, and there's a red sheet covering that. So once you are in here, you are protected from because you are not wearing a gown. But if you are supposed to be in that room inside here, you're supposed to wear a red gown. Hmm? So here, this is for protection for the radiographer. Yeah, so that you don't expose yourself. Because of there is a scatter radiation. Once you take the X-ray, you have to have scatter radiation in the room. And even these doors, they are all red, insulated, so that they will protect the people outside there. So no radiation will come out of this room. The walls themselves, they are made specifically for the X-ray room, very thick, and the radiation protection board, they have to come here, check the room, measure, do everything. They check every door, if there is anything leaking out from the wall or in any other area, so that you don't affect those people who are outside. Yeah.
So, which are the circumstances that one would need to do an X-ray?
Yeah, circumstances in case maybe you had an accident, even an old accident. You know that after hearing, sometimes people either you trip again and then you have a fracture, or maybe let's say you've been having chest problems for coughing, and you don't know what is happening. So you need an X-ray to check so that you know if it is pneumonia or whatever is affecting your chest. And that the chest X-ray explains so much, either the infections of the lung or the size of the heart. Yeah.
Okay. So if someone wants to do a chest X-ray, is there a specific machine that they're supposed to stand on or lie on, or is there a specific machine for chest X-ray, or everyone is supposed to lie down on that bed?
No, the chest X-ray is not supposed to lie. Okay. The best X-ray, chest X-ray, is when you are done erect. Standing, yeah. And that's why you use that bucket over there. See that one? Lying down here is for different examinations. The chest, always, the recommended one is when you are standing, yeah. Yeah?
Okay.
Yeah.
So hand and foot is on the bed.
Yeah.
On the bed.
Hand, foot, abdomen.
And the head.
Eh?
Head.
And you can do it here, you can do it there. Like SMV, for the sinuses, you do it up there. But
okay, so they stand for
yeah.
The nose and...
specific examination like SMV. When you want SMV, you want to see the sinuses. Okay. Yeah? Like when you are ordering for sinusitis, paranasal sinuses, yes. we do that SMV. You don't, yeah. Okay. You don't do prone. I mean AP or TA. Because they will be, but once you do a SMV, all the frontal sinuses will show there, and the muscle, everything. There are cells sorted in the canal.
Thank you so much, Mr. Mbogori.
Yeah.
This is quite an informative lesson, educational. We hope our people, our community will be able to hear and they will learn something about it.
Thank you.
Thank you so much.
Welcome.